Hey guys, it's Dr. Keen, and this is our last part of the blood, and actually, this is our last pre-recorded lecture that we're going to go through for this 6 weeks and for the year. So, this information is about blood typing. We've talked about the blood itself, what it's made up of, the different types of cells in blood, the red blood cells, white blood cells, different types of white blood cells, the thrombocytes and platelets, and what those do, and how that creates clotting and everything like that. Now we're going to talk about a couple of different conditions that can occur in the blood, and then also blood typing. And from the past, a lot of students have been kind of interested in the whole blood typing information because it's kind of hard to understand a little bit. So we'll go through that here in this one. So a couple of conditions that we'll talk about here: bleeding disorders. Most common causes of abnormal bleeding is platelet deficiency, which means that you don't have enough thrombocytes or enough platelets in your blood to actually create a clotting factor, and that's called thrombocytopenia. Remember, thrombo means clot, cyto means cell, and penia means a little bit or not enough, or deficient. So it can cause different problems with clotting and different problems with the way the blood flows through your body. So thrombocytopenia, like I said, you don't have enough of the thrombocytes, so you can't clot properly, and you see many small purplish blotches. It's called petechia on the skin, and that's a sign of that thrombocytopenia. And it can happen because of bone marrow cancer, radiation, certain drugs. If you start to see this, then this is definitely something that needs to be investigated and see why that's happening. When the liver is unable to synthesize its usual supply of clotting factors, abnormal and often severe blood episodes occur. So the liver has a big part in blood processing as well, and so do the kidneys. Vitamin K is needed to produce clotting factors, and that's something that your body actually produces itself. Your body creates vitamin K itself and produces it itself. If there's liver problems or liver function damage, then that can affect that too, which will affect your clotting and your ability to stop blood from flowing. Hemophilia. Most of you have probably heard about this, or heard the word at least. The word technically means blood lover, or a condition of loving blood, which is kind of silly to think about, but basically the reason why that name is there is because these people have very high difficulty of stopping blood flow. So like this condition here, this child here probably just smacked his elbow, and for you and I, we'll just get a bruise. But for him, that bruise never started clotting to prevent that continued blood flow, and then it just continues to flow and flow and flow and fill that space. It's also called bleeder's disease. So for these people, here's another example of hemophilia. These people, even a common bruise or a common bump or scrape could be a problem because their body isn't able to create the clotting factors to prevent that blood from just continuing and continuing and continuing. You can treat it though. It's not something that just, if you get a cut, you're going to die. It's definitely something that you can do for this. Transfusions of blood plasma is important because your thrombocytes are in your plasma, and when you put that transfusion in the body, then they can develop some more platelets to help with that. But they definitely need these therapies to function properly. If you lose blood volume, so if you get a big cut or a real bad accident or something, and you have an open wound and blood starts to leave your body, if you start to lose about 15 to 30%, you're going to see what's called pallor and weakness. Pallor is kind of like when your skin goes pale. That's pallor. You kind of lose the color to your face and that kind of thing. That's pallor. Loss of over 30% can cause severe shock or passing out, and if it continues, it can definitely be fatal. So, blood transfusions are very important for that, and to prevent those major problems from occurring. They're also important for patients like cancer patients and people who are immune deficient, so that they can have a healthier blood and their body can function better. Blood banks have a lot of different samples, and they collect a lot of different kinds of blood. They'll collect whole blood, which is like everything. They'll collect platelets by themselves. They'll collect red blood cells by themselves. They'll collect plasma by itself, and they can hold it in their blood bank for a period of time. In your body, and the way that they determine how to use that blood bank and the blood that they have for people for transfusions is by determining what type of blood a person has that needs that transfusion, and what kind of blood they have stored to give the transfusion. So people have different blood groups and blood types, and there's a way to determine that, because your red blood cells actually have antigens on them that stimulate antibodies in your body and help your body interact with a certain type of blood. So we're going to look at how that works here in a second, but you can see here's the red blood cell. They have all these antigens on there, and then you have antibodies floating around in your plasma also that determine and make sure that you have the proper type of red blood cell in your body. So if you end up having the wrong type of blood in your body, so say you get a blood transfusion and they give you the wrong kind of blood, then you're going to end up having a clotting occurring in your blood, which could create difficulty for blood flow and can cause clogging of your blood vessels and could be a real big problem. Now, if you get the wrong type of blood, does that mean you're going to die because of that? No. There are some things you can do to kind of counteract that wrong transfusion, but most devastating consequences of getting the wrong type of blood is you get that hemoglobin molecule starts to break down and the kidneys start to fail. And that's the biggest problem, is kidney failure when you get that wrong type of transfusion. So there's some symptoms that you'll see, and you can do some things to counteract it and treat it. And the main treatments are infusing alkaline fluids, which is like an IV, to flush the system, and also diuretics. Diuretics are something that kind of gets the fluid out of your body, so it flushes your system and helps your body release the bad transfusion through the urine too. So you can do something about it, but definitely you want to avoid that as much as possible. So like I said earlier, red blood cells have antigens on them, and that all determines what type of blood you have. So if you have type A blood, you have antigens on your blood, A antigens on your red blood cells, and you develop antibodies for B antigens. So that's why there's a problem if you give somebody who has type A blood type B blood, because type B blood has B antigens on it, and if it gets into a body that has type A blood, well, now it's going to interact with these anti-B antibodies, and antibodies are designed to kill and destroy foreign substances. So if this foreign substance is in your body and anti-B antibodies are there, it's going to destroy that cell and create that clotting that we talked about in the last slide. So let's look at how these groups work. So type O, if you're a type O person, that means you are a universal donor. It means you can give your blood to anybody, because you have anti-A and anti-B antibodies, but you have no antigens. So those antigens aren't going to interact with those antibodies in another person's body. And an AB person doesn't have antibodies at all. So group O can go to anybody. Group AB can take in anything because you can see they don't have any antibodies, so they're not going to fight against any of these cells. So AB is a universal receiver, and group O is a universal donor. So group O, they have the antibodies for both, but they don't have any antigens. AB, no antibodies, but they have antigens for both A and B. So you wouldn't be able to give AB to anybody else. They can receive anything, but you wouldn't be able to give it to anybody else because their antibodies would fight against it. Group A, they have A antigens, so you wouldn't be able to give it to group B or group O. You can give it to group AB though. Group B has B antigens, so you wouldn't be able to give it to A or O, but you can give it to AB. So just remember that antibodies fight against the antigen. So if the blood type has the antigen of whatever antibody that cell has, then you don't want to give that blood to that person. Babies develop that early in life, and they will develop that through the development process. RH factor is also something that is determined in blood type, and the RH really all that stands for is rhesus. Rhesus monkeys is where they first discovered these, but then they later discovered it was in humans also. So when you have like an A positive blood type, that means you have an A blood type and you're RH positive. Or if you have a B positive, then you're B blood type and you're RH positive. If you have B negative, then you have B blood type and you're RH negative. So it means that you don't have that RH antigen. If you're RH positive, it means you have the RH antigen. If you're RH negative, it means you don't. So RH negative people should not receive RH positive blood. Now, is it a huge thing? It can be, but initially it doesn't cause major problems. If you do it one time, it can cause antibodies start to develop in your blood, and not necessarily cause a problem that time, but if you have it happen again, then it could become more of a problem, and it could cause some clotting issues and things like that. So where it becomes a big problem is in pregnancy, because if a female has RH positive blood, but then she is developing an RH negative baby or vice versa, then that blood can mix, and then it can cause issues. Now, first time this happens again, just like in transfusion, it's most likely not going to cause a problem. You can have a healthy baby. But if it happens again, then that's when antibodies start to get more and more developed, and then it can cause more issues. So if they discover this, they usually give a treatment of what's called RhoGAM that helps the immune system and helps prevent that problem. Because if it does happen more than once, and you have that happen over and over, the baby can get anemic, it can cause brain damage, it can cause a lot of different things. So they usually test for this during pregnancy to make sure that you are getting the right type of blood. Okay, so when you are looking at the different blood typing and how to do that, you have anti-A and anti-B serums that are used. And when you use an anti-A serum on a type A blood, you're going to see this kind of clumping up like this. And same thing with anti-B, with type B blood. AB, you're going to see it with both anti-A and anti-B. Type O, you're not going to see any clumping at all. So you can have cross-matching with different compatibility, and that can show different types of donors, and we kind of talked about that a little bit ago. So that is all that we're going to talk about with blood typing. Hope you guys have a good day. Bye.